Mayor, councilors, good afternoon. It's July 9th. It's good to be back in front of you again. It's Chief Heppel from Eugene Springfield Fire giving you a quick update as to the status of COVID here at the city of Eugene. First, let's start off with some of our local data. So this is as of Thursday at about noon today. We're up to 271 cases. We had, unfortunately, another double-digit jump in positive and presumptive cases today in the county. So let's look at some of the numbers real quickly. Three things I'm going to point out. As always, I like to point out the hospitalized numbers and how we continue to keep that low, and that's a good indication of how sick or the level of acuity our community members are who are contracting the COVID cases. The next piece was shot is over on the right-hand side of the screen, and how our traditional epi curve here that we're trying to keep flat. We wanted to keep things down in the onesie, twosies area, so we see literally low single-digit positive numbers based on our population moving forward, which means we're containing the virus. Unfortunately, has risen pretty substantially here over the last couple of weeks. So one interesting note of that has been in the demographic where we see most of that jump. And if you look down here from left to right, being from 0 to over 71 years of age, you'll see a large portion of that, I think better than 40%, is actually in the age group from 0 to 30, and there are very few cases that are actually under 10 years of old. So this is where we've continue to see the large rise in this group right here. The fact that a younger population is not going to be as susceptible to this disease with symptoms and higher acuity levels is probably a contributing factor as to why we have such a lower hospitalization rate with just one person in the hospital. And we've also held at three deaths associated with COVID here in Lane County. For testing, always a good question. We've completed over 27,000 tests, and I would propose as of this afternoon, they hadn't quite updated it, but we're well beyond that number right now. And the numbers seem to be maintaining about the same in terms of the spread based on ethnicity as well as race here in the county. How many tests are we doing on a regular basis? So they've added this chart over here on the right, which just shows the total number. The goal has been 500 cases. While I haven't seen the finalized report, my understanding is we had well over 600 tests that were completed last week. So that was pretty good considering that we had a holiday thrown in there as well, but demonstrates that our partners at Lane County Public Health continue to aggressively move forward with testing capabilities, et cetera. Some of the state data we're seeing similar across the state in terms of the rise in cases. We're seeing total positive and presumptive cases per day over 200, and I think we even had a day over 300, and our highest peak day we had just this last week, which is certainly unfortunate to see. But again, the good news is if you look at the lower half of this particular chart, you'll see that the hospitalization across the state also remains to be low as well. So again, that's a good thing to see. Looking at continuing with some state data from their report, which was published yesterday and covered from June 29th to July 5th, which is just this last Sunday. They completed across the state, we completed over 32,000 tests that week, with 1,910 of them being new cases. Unfortunately, though, in this case, that was about a 5% testing positive, which was up from 4.2 the previous week. And that which is up from the previous week before that. So we're certainly not trending in a great direction when it comes to that. But we've also seen, just to follow up with that, this has been another week of increased reported positive cases, more than the previous week, but it's actually 51% increase compared to last week. So the point of this is that it's pretty substantial jump, especially as we get more and more cases and more presumptive cases as well. From the healthcare perspective, it has been our 5th week of hospitalizations have increased, but overall remain low. And again, I've already addressed that because it's probably the younger age population who's contracting the virus. And ICU bed usage remains low, and well under capacity at the statewide level. So that's another good indication as well if the unfortunate event is we start getting quite a few critical cases. One question is how long on the recovery? The state put this in their report this week and talked about it in median days to recovery. And that is 20 days for folks who are non-hospitalized and 26 days for folks who are hospitalized. So, this certainly isn't something that you contract and then it's kind of over with in a few days. It can be for a protracted period of time. Now I'm going to highlight some hospitalizations here a little bit on another slide. In terms of outbreaks, the state's been reporting that the large outbreaks have been diminishing. So an example of that would be, if you remember a couple weeks ago, we talked about the seafood processing facility in Lincoln County, where they saw over 150 positive cases, which was substantial in a population of that size. And then now it's transitioned to more sporadic cases are starting to be increased, which is consistent with more of a community spread. So starting to see more and more of that where folks are contracting it set more in like a business setting or another type of work setting or in social settings where social distancing, face masks, good hygiene, et cetera, are not being monitored. Additionally, we saw a outbreak that was reported yesterday by the news entities of a grocery store in our local area. And so the question is when do those get reported in a public setting? Well, when it comes to a workplace, school, or child care reporting type setting, if they have more than 5 cases and more than 30 employees or students, it's mandatory that is publicly reported. Across the state, those reportings are listed in the state's annual report, which is available on the Oregon Health Authority website. Because of the rising, as you can imagine, because of the acute rise that we're seeing in cases, there's been a heavy demand on contact tracing. And so as a reminder, these are the folks that when we do have a positive case within 24 hours, we want to reach out to those individuals and find out where they've been, what their habits have been, et cetera, so we can make those epidemiological links and get the appropriate folks treatment, isolated, or quarantined as appropriate. So contract tracing continues to be very important in trying to manage this virus. We know last week the governor put 8 counties on a watch list. And so this map shows how every county is a bit of a shade of green. But depending on your shade of green and if you have hash marks determines whether or not you've been placed on the watch list or not. So in terms of the hash marks, that indicates that you're one of the counties that's on the watch list. And what it is that Oregon Health Authority, through the review of your data, has indicated that you're not meeting the dashboard criteria, which I'll review here in a moment, to move forward, or you're not making positive strides in managing your dashboard data to keep you in the current phase you're in. So I would propose that the watch list is a, hey, you need to start watching your stuff. Things aren't going in the right direction. And I would propose that the next piece would be is the governor might direct the county to be regressive. So, for example, to go from phase 2 to phase 1, or even phase 1 back to baseline, which was more of what we knew of stay home, stay safe. So Lane County continues to be in phase 2, as the other counties that are similarly colored and shaded appropriately. So what are some of the watch lists and triggers? Well, you can actually monitor this through the public health indicators, or what they refer to as the dashboard. I pulled up a couple of the counties that are on the watch list, and then I went ahead and put Lane County right in here as well. So some of the reminders of the 6 major things that are being monitored. One is the percent of ED visits with COVID-like illnesses. We need to keep that below 1.5%, and we're running at about 0.7, so that's good. Our trend in percent of tests that are positive in the last 7 days, these should not uptrend. Unfortunately, we've had about a 0.8 uptrend, and that's because of, again, those positive cases. The next one we look at is the percent of increase in new cases in the last 7 days, and should be no more than 5%. And we've had a pretty substantial jump, as you can see from our numbers there. But some good news. So the percent of cases not traced to a known source in the last 7 days, we want that to be below 30%, and that's at 18%. So those are, again, making with the contact resources, making some type of a epidemiological link back to the source. With the trend in hospitalizations, we've never really had any data there. We've always had very single low numbers. And then the percent of cases in the last 7 days that are followed up in within 24 hours, again, contact tracing, we want to be at better than 95%, and Lane County has certainly done a great job there with being at 97%. So as you can see with we really had this rise in cases, but we're maintaining and we're addressing those cases as they come in. So while we're not doing well in 2 of our areas, we're maintaining well in 4 of the other areas. And then you can see just that as a comparable to some of the other counties who have been put on the watch list, as I put in there as an example. Now, what would drive us to regress or change or go on the watch list? That would be something determined by the Oregon Health Authority and the governor's office. They would make that determinant if we would be regressive in that direction. Talked about hospitals a little bit. So what are some of the stays? This is just an interesting data point that came again out of the state report that was just published this week. And the median length of stay for someone with COVID is actually 6 days. And 328 out of 1,144 of the patients that were hospitalized required ICU or intensive care unit level of care or monitoring. So, we're looking there at about 25% of the folks that are hospitalized require a higher level of acuity of care. So the top just demonstrates a number of folks that spent simply 1 to 4 days, folks that spent 5 to 9 days, and then 10 to 14 and greater than 15 days. And obviously we have a few folks in the hospital overall. But you can see how our total number of cases trended up and then trended down, and we've kept that pretty flat, especially when it comes to the ICU component, and that's a good place to be also. I would say this is face mask discussion et al. And all other things. So the face masks continue to be mandatory as directed by the governor on July 1st. Also, OSHA and OLCC have ramped up their enforcement. There was a small blurb on their observations through the 4th of July weekend, and they were really varied by region. Some were the random inspections they did was mostly compliant, and there were some regions that were people were not compliant, or there was low compliance. And it was really sporadic and really by region overall. Where they had started to see some of the troubles were actually in the Central Coast region. Was probably some of the largest challenges they found with folks being compliant. So they provided education to those businesses who weren't not necessarily following the rules, or had customers that weren't either. I talked a little bit about this already, but we're starting to see a slight rise in business-related transmissions. So folks who are going into businesses, et cetera. So compare that with the observations I just talked about. Also, Lane County Public Health and the U of O are doing some age targeting testing. That's based on the demographics I addressed in slide 1. And also some strong education there. Within our Latinx community, there's a focus on testing this week. So they continue to make sure that that community has access to testing because we know that they're a potentially vulnerable population. There's also be some testing events in Eugene next week. It hasn't been solidified yet, but we talked about it at the incident commander's call on Tuesday about how there might be some more targeted specific testing for folks who are like essential workers. So those folks who, like, I'll use as an example, were working at grocery stores or as cashiers, or folks who are working the shelves, et cetera. So they've had a higher propensity of exposure compared to many other folks and maybe other disciplines. So they're looking at doing some testing in those types of areas, again, in the critical worker category or necessary worker category. We've also seen an increase of cases. About 10% of the cases now are travel-related transmission. So that's twofold. One is where there are folks who come from outside our area and are infected and come here. And then the other one is where we have some of our local folks travel out of the area, contract COVID, and then come back. So, so we're starting to see that from more of a migratory perspective. And that's why, that we don't have any travel restrictions in Oregon right now, but there are other states that are starting to have those restrictions. So with that, a quick look nationally, we can see here where green being good and red means a region that's on a tipping point, literally, of cases in terms of ability to manage the viruses, as well as hospital capacity and resources, et cetera. While Lane County lies in that yellow range, the region in the southwest, the southeast, as well as Texas and Arizona, continue to struggle in these cases. So, if folks are planning on travel, you should be looking out to those regions and seeing what the infection rates are and what the rules are surrounding travel in that area. And why I say that is some of the states back up in the Northeast have re-implemented travel restrictions from folks or travelers coming from areas of high infection. One category might be if your rolling 7-day average for your population is 10 cases per 100,000, and you're coming from that region, then you may be required to quarantine for 14 days when you get in that area. So, traveler be warned, and be warned with folks who are traveling into our area that we are starting to see some upticks in that travel spread. It's really not over at all. And so, especially with that, that epi curve going in the wrong direction, but the resources that we have to control and fight this disease process really haven't changed at this point. So, still encourage folks, stay home if you're sick. If you're at a risk, if you're someone who is of the vulnerable population, you should probably be staying home, staying local, good hygiene, wear masks, social distancing, etc. All still are very, very practical at this point. And we need just folks to be compliant with that. So with that, for the update this week, thanks for your time. And as a reminder, wear a mask, maintain your social distancing, keep it local, keep it small, and wash your hands. As always, if you have any specific questions, feel free to reach out to me. I'm happy to point you in the right direction or get the information you have. Thank you very much, and have a nice day.